Depath.
All right, viewers, this is your man, the King, and it is the program, Depath. Yes, Depath is the program that talks about our past history and some of the challenges that we faced when we were actually progressing up to this stage from the olden days of Ghana up to today. Today we happen to be with one of the oldest midwife at the Depath, which is located at the Volta region, closer to Chito. Yes, and her name is Mama. Please, what is your name? Victoria Davo Amenya. Okay, so you heard her name. She is Victoria Davo Amenya. Mama Victoria, please, can you tell us about how midwifery started? Because I learned you are a midwife way back in the 60s, 70s, and the 80s. How did it all started? Ale midwife kwa Jagoma.
Jagoma. From akakanya mauna domta. Ukimana mena anya fuma vagonya malo dovipo ali ukijele londo. Anya ale ko anona lema. Nemonyo wa kudogo na beka ikoji.
Okay.
Ya do.
Okay.
Ko afiaju do ha. Never born of my woman. But no one who I feel over Dumla and Strofa. I live in a very strong hammer for that or Sandalina. Over the Vibo, Managers, that are the Halas. Not 94
Okay. Okay, so as she's saying, before that, we are only trying to talk about how midwifery used to be before the current day clinical midwifery that has been introduced into the system. And she happened to be one of the oldest midwife before she actually started the clinical one. So she was saying that she started small, and anytime that a pregnant woman or an expected mother comes to her, she has a particular places that she feels or she holds on their tummy, the pregnancy, to show whether you are due to deliver or not. And if she holds those spots and all those stuff, and she feels it, and she say no, the way the pregnancy is and all those, or how the fetus is in you, it may not be it may not be ideal for her to handle. Then she will find ways and means to put you in good shape. Eta mama mabinyalo tamai ne Ghana goji ale okapeno agjabe gia labi ale now akpo ale situation na kola the viela double Then wala do ma ye melia ma lo jun akwa abubu gi goji okay
lo jun ko no bubia ka chu kale no chu lo do ya ka mo pe be
Depath. Okay, so with holding some of the sides of the tummy, she can tell how balanced the child is. So for instance, she said when she holds this part of the body for the pregnancy, she knows how the pregnancy is positioned. Then she knows how to actually advise based on that. But Ali, how did you come about this? Concern your
so no e ko mama so e mama broma le ne ma pera ali na de fie le do ma ne ma pera do amoro to la achuga
okay
amoro to la na nya chuga na ma le ko no ko bi alu no chu alu ko bi achuga ka be na yido ko
koji okay
wa wo ni
tama tono ikoji midwife lo le tama
midwife wo le
the ono koji tama
ono tama ono koji kwa upela ku utro
devie. Okay, so according to her, when she holds their part of the tummy, she now gets the balance properly, and they can now advise on how to balance the child in the tummy so that the child or the fetus will be well positioned for delivery when the time comes. So that skills came naturally to her as one way or the other, and she can't really explain how it came by, but this is how the skills says that came about. Then, Mama, normally now obi waji vie. Process come out tomorrow.
Okay. No, wala la. Ko va no boyo. Ke mo no po. Ali ne de vie no to to le do me la no po. Tami waji de vie la. Ke mo po be yi de bi waji. Ele bi na ma agbene vigila agbene vigila be fifi do kaga fu mama la allergy
magbo. So according to her, when they want to leave her, first of all, the pregnant woman have to come and live with her for some time so that she will keep examining the pregnant woman during all this time, you know, so that she will be able to know when the pregnancy or the child is due to come out. Okay, Mama. Eta no ukulele boy
no ukulele ba yin na ma be ju do kwa. Ko obena be fife de vie ele be waji ele be de ba profitable.
Okay.
Eta le be waji, ta le be wasi mi apo.
Okay.
Ko si kwa. Ma wa man go ko. Itola.
Okay. Okay. According to her, so when she now have the pregnant woman living with her and keep positioning the child in the tummy, you know, as the time goes on gradually and all those stuff, she cannot examine the woman, as I said earlier. Then when she realized the pregnancy is due, she now tells the pregnant woman that the pregnancy is due. So they now position themselves for the pregnant woman to you know, push out the baby. I do not know the right word for it. I'm not a clinical person. However, this is what she said. So, Mama, no, my nukaku nukawo mizanko wo kakevio.
Yeah, Miss Asiwi.
Asiwi inyanka gloves. Okay. Can the gloves mavawe inka mizangba?
Ga gloves mava. Miko asiku miko sa.
Miza akwete shalona na kwa class ya.
Miko miza akwete. Ela be spirit ya lele.
Okay. Okay. So according to her, some of the things they use to help bring out a child is either hand gloves, you know, the tiny one, the condom one for the doctors, or they use alcohol base to rinse their hand. Okay, I put a sheep in car. Okay. So they use piece of cloth as well to white cloth as well too. Yeah. Let me wear in Chomano Bonube, you know, a balazan time.
Me and the veggie will be probably the system at
Okay, she said during that time, if the pregnancy seems to be a challenging one that cannot, you know, really be delivered without any aid, they have some leaves that they use for concoction for the pregnant woman to take. So once the pregnant woman takes that herb or that concoction that is mixed out of the herb, it helps the pregnant woman to deliver smoothly. Mama, a flour? Okay, so I will find the name of the leaf in English and put it right under the screen when the time comes. But according to her, in this language, it is called a fla. The language we are speaking currently is Ewe, Tongu language to be precise. Okay, Mama. It's a fla. A fly? Okay. Can a fly? We call new voice. Ziandre. Okay. A flat here called of it. Okay. So according to her, she will put the herb in water and soak it for how many? Okay. Andranya 6 or 7. So according to her, they put that particular leaf in water, soak it in the water for some time, and then you will drink it 7 times. And when you drink it 7 times, they will use the same water and sprinkle it on your belly. So once you sprinkle it on your belly, Mama, enkata mina na mala. Okay. So they do that to soften the child in their tummy, according to her. Somehow there is a medicinal purposes in that, and when they use that, it helps the child to deliver. How many minutes to take care of that? So after 5 good minutes, the child is out after doing that particular procedure. Can I verify? No come okay. Which is the womb. Okay. So, Edra. Okay. So according to her, the child normally comes, or the baby or the fetus normally comes in a cloth. By saying cloth, we are not talking about the normal cloth. We are talking about the shell or the eggshell that the baby finds his or herself in the tummy, which is like placenta, connected to the placenta. So when the child comes like that, they quickly have to tear the cloth, which is the placenta, in order to take the child out of the shell or the cloth, so that the child will be free. Or else, if they fail to do that and the child drinks the water, the child goes back, died, and then that is it. So they make sure they do that quickly to get the child in that good shape. It's an enemy dinner, man. You come in Zao, you can come in Zao. Oh, you can be dinner, Mako. Okay. Don't let me do the Mako. I come here, Pochawi, Mitre, well, I'm here with boomer. Boomer. Okay. So according to her, sometimes when the child comes out like that, sometimes the child goes to we have something we call the 3 cycle of life. We have Depath, boomer, and the womb. So the boomer simply means the child has gone, something like he's gone to coma briefly. So they now turn the child upside down and lifts the child up by the leg, and then beats the back or small tap on the child's back gently. Then eventually the child comes back to life, and then that is how they resuscitate the child to live again. Okay, Mama, can I when I can come?
Namia when I have a can be much on it.
Okay.
Flamananella, but the guitar, living in my black.
Okay.
Me blare. Na no on tia be for training. Malo on tia be for training your cook, you know, Domana, no manatrin and massy, it at the massy.
Okay.
Manassi pete, which all spirit astrology,
but you home. Okay. Okay. So according to her, after that procedure, they now have to cut the placenta, which is connected with the child and the mother. So there is a particular thing called puku. I do not know. Please don't ask me the meaning of that. They use the alcohol base, apply it on that thing, and then cut it, bisect it into two, and then cut off the placenta or the navel, cut it off, and then they take the child off, and then that is it. So okay. Okay. Then the child is taken through the birthing process, and that is it. They now wrap the child in a nice cloth and then present the child to the mother. So this is basically how our ancient or ancestry used to deliver children without the help of clinic or hospital. Before the hospital came in, they normally go through this process, one by one, using alcohol base, which is locally known as akwetesi, and then the efra, which is also the herb, which is put in water. Mama, ngata ono num 7 times. Ngata ono num.
Do he neolentia? If you be bobaro, we mal of the Talimina.
Okay. So according to her, the reason why they normally drink the herbal base or the efra base is because 7 times is because if there is any force or any unknown energy affecting the pregnancy, that herbal medicine goes to soften whatever is withholding the pregnancy. So they have to, it is a must, you do it 7 times. This is how they used to do it. So Mama, no matter how situational lela, wow. Wow.
Never probably imagine it, probably SSM mania got you on your come on, Macamadola for you.
Okay.
If you had a shag when they had no shag, Madola for you.
Okay. Cool. So according to her, she has never received any child or midwife any child that has ever lost its life.
Ever since she started as a midwife all these years, and she's been doing this successfully, all with our herbal medicines right here in Ghana in Volta region. So this is the story of Mama, who is the midwife from the 70s up until now. So she said, when she can never handle the case, she recommend the pregnancy to somewhere else. So Mama, I'm a Ghana Duko. Maybe a VGG man.
Sama kana mi ejevye nemi la na umabawo koji nemi wa mi afomo to ale okutela ka ni mama nya da kai ma ba kuba yin yo ku no vie han ta mi ataka fi gbede ka bia mo na ru ma to ya do ma ka no vie ho to ta e ko jimi no wa fe gba ba so no lo ga ba gba so no lo ko yi asi una agbala ko bani ta le de do kwa anyesiku adaka le
okay. So according to her, they've actually delivered a lot of children twice with the help of her mother, who used to assist her way back. So this is what she's been doing. Sometimes in a day they deliver about 4 or 5 children at a go from other families and other stuff. So I know there are other questions that you may ask, but look for part 2 later in this content. Don't forget to subscribe to the channel This is your man the king, and I'm out like that.